The Graves trial is titled Graves PCD trial, and PCD stands for plasma cell depletion. And this comes about because we know that Graves' disease is an autoimmune condition which involves our B cells and plasma cells producing antibodies in response against our own thyroid gland. Now, usually we produce antibodies against infections, but this time we've got antibodies against your thyroid, and the result is that your thyroid produces excess thyroid hormone, and sometimes it grows in size to form what we call a goiter. In some patients, it also affects their eyes, especially patients who smoke, and that can be quite debilitating as well. So in the Graves PCD trial, we use a drug called daratumumab, which is a monoclonal antibody. It targets specifically a CD38 receptor. This is a small receptor we have on our B cells, our immune cells, and in so doing, it depletes and destroys all these B cells. So we're trying to target the actual cause of Graves' disease. And so far, for more than 50 years now, we've used anti-thyroid medications. So in the UK, we use carbimazole and propylthiouracil. These medications target the thyroid gland function, and some patients, half of patients, manage to come off medications, whilst the other half, unfortunately, relapse. And they will have serious discussions about moving to definite treatment like surgical removal of the thyroid gland or radioactive iodine. These are all very efficacious treatments. However, they don't suit every patient. So our aim is to try and find an alternative and possibly target the disease from the source and cure it in that way. We start with patient recruitment. So my role at the RVI as a clinician in the outpatient setting is to see patients with Graves' disease, and sometimes we can identify patients who might benefit from a trial. So in those scenarios, we offer these trials to patients. The second way is probably through advertising. So patients who are a bit more proactive in their management of their own conditions might have come across a trial advertised on British Thyroid Foundation and might be in touch with us through those means. And then sometimes we actually ring patients ourselves if we know that they might be suitable for the trial. So from that point onwards, then we meet on the CRF, the Clinical Research Facility, to discuss the trial in more detail with patients, take consent, explain what it would involve, and then proceed with the protocol visits after that. In total, so the trial was divided in 2 stages. We had stage 1, where we recruited 15 patients, and each were randomized to a placebo or different doses of daratumumab. And then following that stage, we had a short break of analysis where we identified that the highest dose of daratumumab gave the best results. So the second stage followed, where we used a higher dose, the 9 milligram per kilogram and 16 milligrams, which was extrapolated from the first stage, and placebo. And in the second stage, we recruited another 15 patients, so 30 patients in total. So we had 3 main eligibility criteria. One of them was that you should be older than 18 to participate, and the second one was that your thyroid receptor antibody should be greater than 10, and finally you had to be diagnosed with Graves within the last 12 months, or else had a relapse within that time frame. If you fulfill all those 3, then we've got minor criteria like patients who've got a goiter or eye disease, and they would have to fulfill at least one of these other minor criteria. And with that, we've also got exclusion criteria, unfortunately, which goes with every trial. So patients who are planning to get pregnant or had any significant comorbidities, or patients who had underlying viral infections like HIV or hepatitis B or C. Those patients unfortunately couldn't participate in the trial for safety reasons and because of the fact we're using a drug that can decrease your immunity. We've managed to conclude the study in March, so since then we've had a short analysis of what the outcome was, and we can say that by 12 weeks we see a clear decline in antibodies by 70% compared to placebo, which is at 50% at that time frame. And then both the placebo arm and the drug arm continue to reduce antibodies more gradually after that. We're currently in the Life Center where we process the rest of the results with flow cytometry and transcriptomic analysis as well. So we're excited to see what those results will look like, hopefully soon. Like with any medical condition, I think one treatment doesn't fit everybody. So there's always a need to explore new treatments. And over the years, we've learned so much about Graves' disease and the pathophysiology. So I believe we are in a very good position to explore even further. And even though we do have very good treatments available, we would still like to explore further because we know that it doesn't suit everyone's journey with Graves. So I really believe that it's a trial which is needed, and I do hope that we do get reassuring results which can be used then thereon to help patients.